Good morning, everyone. On behalf of the Wood County Committee on Aging's Lively You Virtual Learning Academy, we have a presentation today on osteoporosis from Jessica Tzou, St. Luke's Family Medicine. So please welcome.
Hi, my name is Dr. Jessica Tzou. I am one of the residents at McLaren St. Luke's, or that's who we are now. I just wanted to talk a little about osteoporosis, which I know is something that affects many of us, and or if it's something that we are worried about in our futures. So to start from the top, basically, our bones are living tissue. So there are cells in it that both build it up and break it down, and normally that's at a balance. Unfortunately, our bodies change as we get older. Unfortunately, not built for forever. And so that balance can get out of whack. And so osteoporosis happens when the breakdown is either happening too quickly, or the rebuilding isn't happening quickly enough, or some combination of both of those things. And so the bones get a little more porous, weaker, and more brittle. But you can't tell that it's going on. So it's kind of like living with high blood pressure. You don't know that this process is going on in your body until it starts to have effects. And so very often people might have maybe fractures, compression fractures in the spine, which you can actually have without even having symptoms. But that may be why you may remember your mom or grandmother getting more hunchbacked, or maybe getting shorter as they get older. That's probably due to osteoporosis in those spine, in the spine. What we are more afraid of is fractures of the hip, and this happens when we fall, and unfortunately, falls account for 87% of fractures in older adults, and 85% of injury-related hospitalizations are due to falls. And if our bones aren't strong enough, we can hurt them. And hip fractures are sort of what we're most afraid of, obviously. It immediately puts you out of commission. You can't be walking or exercising with a broken hip, and then there's sort of the long recovery. You may or may not need surgery. You may be stuck in a brace or in bed for some period of time. And obviously when we're not moving, we're not getting stronger. And so there actually is a higher risk of death after hip fractures, up to 17 to 30% even within the first year of a hip fracture. So our goal is to keep our bones strong and prevent falls. We've probably all heard of osteoporosis as being more common in women, and that is true particularly after menopause. When we're younger, the estrogen in our body somehow helps keep our bones stronger, but after menopause, we lose that protective effect. So men obviously don't have that same estrogen, and so their risk isn't quite the same. But as they get older, over 70 or 75 particularly, the risk of osteoporosis is similar to women. And then they may have other risk factors, which we can talk about later. So let's see, hip fractures are common. There are over 300,000 yearly in the US. So our goal is to see what we can do to prevent them. So looking at risk factors for osteoporosis, there are things we can change and there are things we can't change. So let's actually start with ones we cannot change. So obviously we talked about gender. So women, again, have a higher risk of osteoporosis just because we undergo menopause and there's that big hormone change, and therefore our bones undergo a big change at that time, or getting worse over time. As I talked about, men do have a risk of osteoporosis too, particularly as they get older than 70 or 75. They have a greater risk actually of hip fracture after 75 than women. And then the mortality rate, or risk of death or poor outcome is actually almost double in men. So that's about 31% in that first year after a hip fracture compared to women. So one, if you fall, make sure you work with physical therapy and get stronger and try to get moving again. Other risk factors that men might have, if you are on steroids for any reason for greater than 6 months. So whether that's because you have really bad COPD and need steroids to help gut the inflammation, or really bad rheumatoid arthritis, that might be a reason to be on steroids long term. So that's a risk factor for weakened bones. Anyone with a history of non-traumatic fracture, so you didn't fall, you weren't in a car accident, you just kind of whacked into something and broke a bone, that obviously is a high risk for osteoporosis. Obviously getting older and a family history of male osteoporosis for guys and low testosterone, which again is rare. It is rare, but if you're concerned, your doctor can do tests to check for that. Again, moving on. So the risk of osteoporosis increases with age. We can't change that, unfortunately, but we can do things to decrease our risks. Interestingly, our whole lives we're told, hey, lose weight, stay active. But there's actually an increased chance of osteoporosis for folks who are very small and thin. So we're talking, if you're 100 pounds, you probably have a higher risk than if your bones are heavier. So if you're on the very light end of the weight spectrum, you do have a slightly higher risk of osteoporosis and osteoporotic fractures. And then ethnicity, Caucasians actually and Asians have the greatest risk of osteoporosis. So now that we talked about all the things we can't change, let's go to ones that we can change. So lifestyle choices, it's important. And we're told for much of our life, hey, quit smoking, quit smoking, quit smoking. Again, one more time, quit smoking. Increasing, really trying to cut down your risks. So smoking affects so many systems in your body. It's not just your lungs, it's your blood vessels, it's your, in this case, bones. So quitting smoking can really help decrease your risk. Also cutting down on alcohol. So we want to talk about moderation here. I know lots of people enjoy that glass of wine with dinner. 1 or 2 might be okay, but beyond that, you really want to also be careful because, again, a lot of alcohol intake can cause you to fall. So also cutting alcohol down, and surprisingly also caffeine. Cutting down caffeine use will also decrease your risk for osteoporosis. Now, we're not talking about, cutting out completely your cup of joe. We're talking about, 2.5 cups or less a day, or if you're a tea drinker, less than 5 cups of tea a day, which for me is pretty easy. That's a lot of running to the bathroom. That's a lot of tea. Other things, keep moving, okay? This is very much the use it or lose it philosophy of life. You want to keep your muscles moving because it's actually your muscles pulling on the bone that strengthens the bone. So that means, walking is great. Absolutely. We love walking. If your knees hurt, we want to do other things. Yes, you can do water exercises, but I really need you also to be doing resistance training. So that's, resistance stretching bands, you can do with arms and with legs, body weight exercises, also doing balance training. So this is actually different. If you think of, hey, how easily can I stand on one leg? Am I super wobbly? Obviously, if you are super wobbly, you're more likely to fall. And so it's balance training and also flexibility. So you can think immediately of yoga, or you can just honestly stretch. So you might think, hey, if you hurt a shoulder and you don't move it because it hurts, you actually increase your risk of, say, frozen shoulder. So same thing with your legs and your bones, is using your muscles strengthens your bones. In terms of diet, same age-old recommendations, lots of fresh fruits, veggies, simple foods. So meats obviously are great. Don't go for really highly processed things, lots of fat, you're increasing your risk of other things, but we want a very varied diet that also makes sure that we get the nutrients and the micronutrients that we need. So things that we think about when we think about, hey, my bones aren't strong. We think about, hey, calcium and vitamin D. Let's drink milk. I think that was a whole campaign when I was growing up, is drinking milk strengthens your bones, which is true, but maybe you don't tolerate milk. You might better tolerate yogurt, honestly, milk, cheese, almonds, broccoli. Honestly, broccoli has a surprising amount of protein, which I found out the other day. So it's protein and has calcium. And vitamin D helps with calcium absorption. And obviously our bones are in large part calcium. And so vitamin D is a vitamin that your body actually makes. And spending time, a little bit of time in the sun, obviously uncovered skin, helps your body make sufficient vitamin D. So that's recommendations to, spend 30 days outside in the sun 5 times a week. If that sounds like a lot, or if you're really scared of skin cancer, you can also obviously take supplements. That's between 400 to 800 international units, or IU, a day. And you'll see that with any of the generics. They'll have numbers on them, and you want to make sure if you're taking calcium, as it says on there, you take between 1,000 and 1,500 milligrams a day. And for vitamin D, that'll be 400 to 800 a day. Usually that's 1 or 2 tabs. And I like putting those numbers on there just so you can have it to refer to. So fall prevention, that is the next big risk factor, obviously, that we want to look at to avoid fractures due to osteoporosis. So if we actually scroll to the very end, the 3rd page of the handouts, I don't know if I can do that. No, I can't do that. Okay, but this is the Ohio Health recommendations. It's a giant picture, and then the words unfortunately are tiny. So I'll go over some of the basic recommendations with you. But the fall prevention checklist. And it's things like good lighting, having good lighting between the bedroom and the bathroom, so that you don't trip on the corner of the wall and fall down in the middle of the night. Having handrails on stairs, say going into or out of the house, is important. Grab bars in the shower. I know a lot of people have that. I think it's cute that in this picture they actually have grab bars next to the toilets and the shower in this cartoon house. Other things, some people like textured pads with the suction cups in the bathtub. Just a word of warning to make sure that the edge is really smoothed down, so you don't accidentally kick it with your toe and then you've gone down for that reason. You're trying to stay safe and you're making it worse. Speaking of tripping on the edges of things, we actually recommend, or it is recommended now, to take rugs out of hallways and wherever else you may have area rugs, to tack down the corners so that you don't trip over them when you're rounding next to the table, for instance. Sort of common sense, try to keep the floor clear of clutter, keep cords tucked away into the corner. So if, for instance, you're using a cane or a walker, that it doesn't get caught as you try to maneuver that thing around the edge of the table, that there isn't also a cord that the leg of the walker could get caught in. We also recommend wearing supportive rubber-soled shoes, avoiding socks, obviously, they're slippery. It's probably past the time when most of us should be skating on socks in the kitchen. And then some people, you want to be careful if you're using slippers or something that's easy to slide your foot into, that it also still has a rubberized grip on it. Because obviously slippery things will increase your risk for falls. Other things to do, it's always recommended to have a yearly vision test. So go see your eye doctor once a year. It's not just glaucoma and cataracts, sorry. It's not just glaucoma and cataracts, but also, you know, do you need to change is your distance vision changing? You can read just fine, or maybe you need, you know, bifocals, or maybe you need to leave those readers on top of your head when you're walking into the kitchen. Okay, I think that's mostly it for the home checklist. So avoiding falls is actually really important to preventing fractures. It sounds maybe basic, but again, important. It's the common sense things. So how do we find out if we have osteoporosis? So generally there are recommendations for screening women over 65, and then there are mixed recommendations for potentially screening men over 70. Basically, your doctor will talk to you about, you know, your personal history, maybe of fractures or say steroid use like we talked about earlier, and family history to look at risk factors and determine when a DEXA scan is appropriate. So a DEXA scan, it's just x-rays. And basically, again, it's looking at how dense the bone looks on the image. Only takes about 15 minutes. DEXA, if you care, stands for dual energy X-ray absorptiometry, which is exactly what we call a DEXA scan. But basically what it does is it calculates numbers and it compares your bone density to a healthy young adult. And then like most things, it's on a bell curve. And so if you're on the way tail end of it, so if you're familiar with statistics, if you have a T-score of less than 2.5%, so you're in the bottom 2.5% of everyone's bone densities, then you're considered to have osteoporosis. The step before osteoporosis is osteopenia. So if you have heard of that, that is what that is. And on the handout, that was the middle picture. So sort of in between normal and too many holes. Your doctor may do some follow-up labs or review your medications. Again, so there are different medications that may increase your propensity towards osteoporosis. Some of that is new data that we're just learning now. And there are also medications that can increase our risk for falls. So that's something that you should go over with your doctor, sort of your list of medications, and see, do we really need to be on this? Is it worth, again, the risks versus the benefits? So that's a conversation I do want you to have with your doctor. And then DEXA scans usually are repeated every 1 to 2 years, up to every 4 years. Again, there are no good guidelines, unfortunately. But we do like to keep tabs on your bone density and see, is it getting better? Is it getting worse? And what can we do about it? So obviously, there are medications you can take. So bisphosphonates are the first line therapy, and they are, and most of them are oral medication that you actually have to take very specifically. You have to take it with a big glass of water, and then you have to sit upright, so you can't go back to bed immediately after. But I figure it takes most of us about half an hour to do, I don't know, our teeth brushing and this and that in the morning before we lie back down or sit anyway. So we just have to be upright for over half an hour because it can really irritate your stomach. Research has shown that after about 5 years of treatment, you don't get much more benefit. So at that point, the medication should probably be stopped. there are some injection forms of this medication class. And again, all of these sort of cut down on the cells, on the activity of the cells that are breaking down your bone. And so there are, again, injections, but they're more costly. They are once monthly, but they can surprisingly also still cause stomach upset. Hormone therapy, we've all heard a lot about. For a while, it was almost mainstay. We're like, oh, menopause is when your body stops making estrogen, so we'll give you some. Unfortunately, there's been some data that shows, it can increase your risk of breast cancer or ovarian or cervical cancer. So now there's recommendations are, well, if your menopause symptoms, those hot flashes or night sweats are so terrible that you just can't bear them, then it's worth maybe trying hormone therapy for a shorter period of time. They recommend now a maximum of maybe 2 years. So again, it's kind of temporary and there are risks. For men, again, you have to have a demonstrated lab value of the testosterone in your body is too low before you want to go the route of injections of testosterone. I know that there are topical testosterone formulations. Those actually have not shown any benefit in terms of osteoporosis prevention, at least, or treatment. And then there are other medications of drugs, SERMs, as you see below, selective estrogen receptor modulators. So they're kind of like the hormones, except they don't give you an increase of breast or uterine cancer. But like estrogen, they also increase the risk of blood clots. So it's a mixed bag. And obviously there are other classes of medications, calcitonin and teriparatide, which may or may not be appropriate for you, but your doctor can talk to you about it. Now, just to recap, the most important things that you can do to to improve your osteoporosis or osteopenia, and to prevent your bones from getting too thin are things we talked about earlier: quitting smoking, decreasing your alcohol intake and your caffeine intake, and exercise. I love exercise. It's a big thing. It's very important. It's one of the most basic things we can do is keep moving. So that includes mostly strength and balance training here. And if you're concerned that, I'm just not getting around as well as I was before, or I'm afraid of falls, or my balance is just not great anymore, you can actually talk to your doctor and have maybe have them refer you to a physical therapist who can specifically teach you balance and mobility training. There are places that do that. So that would be important. Our goal is to keep your bones healthy. So use your muscles, which work against your bones, to keep your bones strong, and don't fall. So review that checklist for ways to prevent falls. Get a little bit of vitamin D and calcium. So whether that's in things you eat or in supplements over the counter, or a little bit of sun. All right, go take a walk on a nice day. Maybe not today, it's raining. Okay. Okay, let's open up to questions.